Welcome, everybody. FCAA is proud today to partner with our friends at the Global Philanthropy Project, Africa Grantmakers Affinity Group, and Human Rights Funders Network to bring this important conversation to an important group of people. Today, we're going to be talking about building support for national level health advocacy. FCAA on World AIDS Day just released its new strategic plan, which still talks about, of course, ending the HIV epidemic, but importantly focuses on the need to build empowerment, equity, and justice for neglected communities, to build health and human rights and social and economic opportunity, and to promote government accountability. And that's why we want to be part of this important discussion today. And we thank our other partners as well as our speakers. Before we get started, I'm going to talk about a few logistics. All attendees will be on mute. The session will be recorded, and you can offer comments via the Q&A function. Hopefully the instructions on the screen will help everyone understand the way it works. So today's agenda, I'm here to welcome you from Funders Concerned About AIDS. We're going to be hearing from Marja Esveld about the value of health advocacy from a funder's perspective. Then we're going to hear from Felista Haakum from ARASA, who recently released a very important report that she'll talk with us. Next, Alan Malesh from sorry, I have my notes. Alan, I'm sorry, I'm blanking on the director of the Kenya Legal and Ethical Issues Network on HIV and AIDS. Sorry about that, Alan. We're also going to be sure to save time for questions and conversation. But we only have an hour, so I don't want to take up a lot of that time. I want to really begin by turning it over to Marja Esveld from the Ministry of Foreign Affairs in the Netherlands.
Good afternoon. Can you hear and see me?
Yes, we can. Thank you.
Sorry, it was low on batteries, but it's better now. Well, thank you very much for joining us this afternoon and for taking the time, so just before Christmas, to discuss an important issue. My name is Marja. I work at the Ministry of Foreign Affairs. I'm Deputy Head of the Health and AIDS Division. And I'm also a board member to the Global Fund on behalf of the 0.7 constituency. So Norway, Sweden, Denmark, Luxembourg, Ireland, and the Netherlands itself. And as part of our work, both in the Global Fund, but also outside the Global Fund, particularly now recently in relation to the COVID pandemic, we see more and more real proof that local advocacy and local demands for accountability on investments for health, not just for the 3 diseases, but broader, pay off. They lead to, in many cases, they lead to more transparency from the government, and they also can help have a proper discussion around roles and responsibilities of different partners in global health, not just the donor organizations, but also the importance of proper domestic investments. So from us, from a donor perspective, we feel it is important to have these conversations. It is important in our discussion around future sustainability of all our investments. And it is also an important mechanism to ensure proper leadership at government level. At the same time, although we do fund investments in civil society support and in supporting, as we call the voice of civil society at country level, funding is also fragile. Different donors have different flavors of the day, and ministers come and go, and sometimes funding gets stopped because of certain reasons. We also see that funding is very much linked to specific topics. So you have the funding for specific advocacy on HIV/AIDS, on TB, on whatever. And we wondered collectively with a few of us, also given the whole discussion around universal health coverage, wouldn't it be good to better organize advocacy at country level, and not just around a specific topic, not just around a specific group of people, but more general, in order to strengthen the overall voice of civil society, and to also make sure that we make best use of our resources, both financially as other types of resources, the guys who do the work. So Joep Lange Institute set up this process. They had a meeting last year with many civil society organizations worldwide to discuss options for instance, a pooled funding mechanism, or at least more collaborative efforts. And currently we are reaching out to several donors to test the waters and see if there's appetite to join us in this discussion, and to potentially join us in setting up a funding mechanism which is more sustainable and creates a broad voice from the South that can help us in reaching the SDG 3s, basically. Responses we get from different partners are different. Many donors tell us that they already have their own national programming, and that works very well, of course, for all different reasons. But we also see that there's general acknowledgement that more can be done, more should be done, and that better alignment is the minimum that we should aim for. So today's discussion, also we would like to hear your views on how we should go forward, what you see as options and possibilities, or as potential hurdles when we discuss the topic of strengthened advocacy at country level. So we also are very keen to learn what you think you can do as an organization to contribute in this discussion. I think I'll stop here as a kickoff.
Thank you, Marja. Next, we're going to hear from Felista Haakum from the AIDS and Rights Alliance of South Africa on the current state of funding for civil society, health, and human rights advocacy.
Thank you so much, John, and thanks to you, FCAA, and everyone else for having us. It is a great pleasure for me to be in your company this afternoon, well, almost late afternoon in Windhoek, scorching hot Windhoek, Namibia. But it's a real pleasure to be with you today and to share the findings of a mapping that we've done recently on funding trends for HIV-related social enablers in Southern and East Africa, which we launched, as John said, last week on International Human Rights Day. For the purpose of our study, we defined, I'm just checking if I've got the right slides up. But for the purpose of our studies, we defined social enablers as strategies, activities, and approaches which create environments which promote the accessibility, acceptability, uptake, and equitable coverage, quality and effectiveness, and efficiency of HIV interventions and services. Social enablers also include the 7 human rights programs recommended by UNAIDS to address human rights related barriers. Next slide, please. The value of social enablers in the HIV response is well recognized. In 2016, world leaders at the United Nations General Assembly committed to invest at least 6% of all global AIDS resources for social enablers, including for advocacy, community and political mobilization, community monitoring, outreach programs, and public communication by 2020, and ensure that at least 30% of all service delivery by 2030 is community-led. The political declaration also contains a related commitment around embedding human rights into the HIV response by committing that national aid strategies would empower people living with HIV and at risk of and affected by HIV to know their rights and to access justice and legal services to prevent and challenge violations of human rights. But more recently, as a few weeks ago, it might actually have been last week, the critical role of social enablers was once again recognized in the inclusion of 3 targets related to societal and service enablers in the 2025 targets that were proposed by UNAIDS. But now to our study and a little bit more background to the mapping that we conducted. In 2018, we conducted a partner audit with our 100 partners at the time. And this partner audit really surfaced that a significant number of our partners had experienced a decrease in funding for their human rights and social enablers work across the region. In response to this, we commissioned Equal International with support from the Robert Carr Fund to document and assess the current funding environment for community-led HIV responses to HIV, but with a specific focus on how it affects civil society's ability to implement programming to address social enablers, including advocacy, community and political mobilization, et cetera, and human rights programs such as law and policy reform. Just as we were about to launch that report, COVID-19 hit, and soon it became clear that the pandemic was affecting funding for social enablers. We halted the launch of our report and undertook a second phase of our research to explore how COVID-19 was impacting on funding for social enablers, particularly at the height of the lockdowns at the time. But our methodology overall in this 2-phase process included a desk review. It included, I think you can go to the next slide, Sarah. It included a desk review, an online survey with our RASA partners, key informant interviews, which included civil society, community-based organizations and donors. And as previously mentioned, this process included 2 different stages, with the second phase on COVID-19 also including a desk review. Our respondents represented local, national, regional, and global civil society organizations, and also included representatives of donors who fund social enablers and human rights work. Next slide, please. One of our main findings was that close to half of the respondents reported that an overall decrease in their funding had happened over the past 3 to 5 years, and more of them then had seen an increase, which was only 33%, while 20% said their organizations and funding for their organizations had remained stable. As you can read on the slide, one of the quotes that we got around this question was, "The landscape has changed dramatically. It's not shifting for the better. There is shrinking funding. When you look at the big donor organizations, they themselves are going through their own changes in strategies, engaging in transitions, phasing out of countries." For those who had actually seen a decrease, the main reason was a change in donor priorities. As some respondents reported that donors were moving away from a focus on HIV, as I just read in that quote, while others said that within HIV funding, there was less funding for community-led responses, social enablers, and human rights. Next slide, please. The main barriers to funding for community responses that we found in our mapping included the shrinking civil society space, as many countries in the region are limiting freedom of association and expression for civil society, including restricting their registration and operations. Another barrier was the rapid changes in donor priorities, a mismatch with strategic plans, a shift away from core funding to funding primarily of program activities. And one of the quotes that we received during the mapping was, "Our greatest challenge is that when we have a donor, it's project of 1 year. You are doing good work, but it comes to an end. You are just getting started, then you have to start winding down. People build expectations. They still come to our offices, but you can't offer them services. You have a vibrant staff, but when the project ends, there is brain drain and you lose them. Further, organizational capacity issues are a significant barrier, as donors see funding of community-based organizations as too risky because of their less established nature and the fact that they're still building their systems and processes. I think you can go to the next slide, Sarah. Human rights interventions really require funding to be different and to be agile and responsive to changing environments and contexts. Many of the organizations, and I think this is actually the next slide, many of the organizations that were interviewed felt that the entire US government HIV funding approach and the approach of human rights and community-based organizations are not aligned at a fundamental level. And so during our study, we really went to hone in on some of the biggest HIV-related donors and what the barriers are to them supporting and funding social enablers work, including advocacy and human rights programming. And so in particular, we looked at the US government funding, and then we looked at Global Fund funding. And as I mentioned before, many of the respondents felt that at a fundamental level, in terms of human rights values and beliefs, that there was a fundamental difference between the work that they wanted to do and what the US government was funding at the time. So this was, at the height of the Trump administration towards the end of last year and the beginning of this year. Many community organizations which had engaged or attempted to engage with PEPFAR felt that PEPFAR processes were difficult to navigate, intimidating, very technical, very biomedical, rigid, and contained a lot of bureaucracy. Despite this, they did witness some positive changes, including PEPFAR's commitment to shift towards greater funding for indigenous organizations and inclusion of civil society priorities identified through the People's Country Operational Plan processes. Regarding the Global Fund, there was an acknowledgement that Global Fund funding had dramatically increased in relation to funding human rights work. But a lot of the respondents' experiences as implementers of Global Fund programs depended significantly on the country coordinating mechanisms and the local principal recipient, with several of the respondents saying that it was difficult for smaller indigenous organizations to compete with larger international organizations for Global Fund funding. And then next slide, please. So although I won't dwell on this, oh, can you go back one slide? Sorry. Although I won't dwell on this, the findings also included indications that all the organizations in the study access most of their funding from foreign donors, and very few access domestic government funding. A very limited number of respondents mentioned accessing alternative sources of income, mainly through consultancies, but this was not significant. It was not a significant amount for any of them. In terms of other methods of innovative funding mechanisms, participants were aware that they existed, but none of them had any direct experience of these innovative funding mechanisms. Just on this slide, I think it's so interesting that in terms of corporate social responsibility, there's a quote that says, corporates like funding teddy bears for sick kids. Because we work with sex workers, drug users, and men who have sex with men, these are not very popular causes. So there's a recognition that it's very, very challenging to access corporate social responsibility funding, because the issues that the partners that do social enablers work on are quite sensitive and unpopular. The next slide, please. So for the impact of COVID-19 on funding for social enablers and organizations who do that work, it emerged that COVID-19 had caused a significant disruption on the work itself and the implementation of activities of the organizations, but had differing impacts on their funding situation. While some partners experienced delays or decreases in their funding, others were able to access small grants to mitigate the impact of COVID-19 on their constituencies. Overall, donors were seen as very responsive and flexible, and all respondents reported working with their donors to reprogram their grants to respond to the changed circumstances. All partners also shared a sense of uncertainty about the future and are very worried about what will happen after the end of the current grant cycles, as a global recession is likely to make donor countries more inward looking. Some of the recommendations that have emanated from this study, and we can go to the next slide, please, include a call for more flexible, agile funding and a recognition of the inherent difference in funding for social enablers as opposed to service delivery work, a call for donors to review their reporting templates, budgets, and monitoring frameworks, which are more tailored towards service delivery and are not fit for purpose around social enablers work and human rights programming in particular. There's also a call for longer term investment. As one of the quotes said, some of the people felt that just as soon as they were starting to gain ground in terms of the implementation of their activities and starting to see some impact, the grant would end and they would then have to wind down. The third, one of the third recommendations is that donors should coordinate better amongst themselves, particularly where they are like-minded donors and they are likely to fund similar types of work. It would make it a lot easier for smaller organizations, particularly those on the front line of implementing social enablers, to adopt, if donors had common indicators and ways of evaluating their impact. There's also this call, and I think there's a movement on the way internationally around this common kind of consensus around what are community-led responses, what are social enablers, and how do we measure investments in community-led responses and social enablers. Next slide, please. Another recommendation for donors was to support consortia, and another study that we did at ARASA looked at the impact of COVID-19 on community-led responses, and one of the findings there was really clear that those organizations who had already worked in partnerships and had a strong sister network of partners that they worked with were the most able to adapt, but also to retain their mandate to continue implementing, but also to join the work around COVID-19. So it emerged that it's really important for donors to support work by funding consortia. Also to see beyond the proposal, as many proposals may not capture the specific skill sets and expertise that organizations have, particularly their access to communities and how well they understand the needs of their communities. And to minimize bureaucracy, I spoke about this a little bit earlier around kind of reporting, reporting requirements, etc., that may be quite challenging. Next slide, please. This is just to direct you to where you can find this report, www.arasa.info, and then to just acknowledge the work of the researchers at Equal International and the support of the Robert Carr Fund and all of ARASA's donors for us to be able to do this work. Thank you so much.
Thank you, Felicita. We're now going to turn to Alan Maleche, Executive Director of the Kenya Legal and Ethical Issues Network on HIV and AIDS.
Thank you, John, for the opportunity to speak to our colleagues, part of the Association of the Funders Concerned Against AIDS. I once spoke a few years back, but then it was in person, but unfortunately COVID does not allow for us that to happen. I want to build up on what Maya and my colleague Felista have said and speak to colleagues about an initiative that Maya and I have agreed to co-chair with the support of the Job Lang Institute that is convening us to try and bring together public and private donors, civil society leadership, and multilateral institutions to discuss the value of advocacy in meeting health and development goals, and of course the need for increased and sustainable financing to support health advocacy at national levels, and methods to secure and disburse these resources. And so, based on what Felista has shared, it is indeed a challenge in terms of health advocacy being supported consistently throughout the lifespan of civil society organizations. We are very aware of the adverse effects the coronavirus has had on people over the last 12 months. And as the world continues to struggle with this particular threat, we have seen how civil society has immediately stepped in to breach providing services, protecting rights, holding governments to account, and also advocating for evidence-based health policies and practices that strengthen high-quality access to services. And I think we are all aware of the positive impact, and there are very numerous examples over the past 20 years around the impact of health through advocacy by civil society, especially in HIV, in TB, in malaria, in sexually reproductive health, disability rights, drug pricing, drug policy, and maternal and child health, you can name them all. But what is really key is, and reliable, is that sustainable funding is a key challenge. And I think the report by our colleagues at ARASA clearly indicates that, and advocacy, especially for health, has consistently been underfunded, particularly at the national and local levels. And sometimes even for organizations like KELIN that do hardcore human rights litigation, some of the resources cannot come from domestic governments, as this funding must be independent, and sometimes governments may not fund you for you to be able to hold them accountable. So resource for advocacy for health, therefore, is an essential component. And that's why Maya and I have agreed to co-chair this process that would allow us to get donors around the room, get civil society around the room, get multilaterals around the room, and seek to get an anticipated outcome of the process that will see increased alignment of resources for national level health advocacy and a proposed approach to resource mobilization and disbursement. And so this is a process that we encourage many people, especially funders, to join us in 3 phases. The first phase, which I'll talk about in detail, involved a civil society conversation. The second phase will involve a conversation between donors and civil society and multilateral agencies. And the third phase will initiate a conversation going further to see how does this happen. But I want to focus more on the conversation we had in the Netherlands on the 12th to the 13th of February earlier this year, where we brought together attendees from about 40 different countries, both global north, global south, and mostly organizations working at the national level, where we discussed the need and the key roles of advocacy at national levels in improving health access and meeting development goals. We talked about establishing broad-based coalitions across different health sectors for improved health access and right to health. And we also talked about the values and principles that should drive any proposed funding mechanism to support national level health advocacy. And of course, the need for alignment with other resources, because we know there are already donors, there are already institutions, there are already organizations that are funding some of these particular processes. And I think participants who were this meeting really emphasized on the need of creating an enabling environment to advocate and build coalitions and campaigns to advance the right to healthcare. They talked about the importance of supporting national level advocacy and to push for inclusive UHC efforts, improve quality of health services, increase domestic resource mobilization, and most importantly, protect human rights within the health systems that many funders have continued to support. And also the participant thought and agreed on the fact that we need to build and support a global coalition of health advocates across multiple health issues. And no specific mechanism was agreed upon, but a pooled funding mechanism was one of the options that was considered. However, civil society are open to conversations with various players, and in doing so, we have agreed and deliberated on certain values that should drive funding for national advocacy. And some of these have been reflected by the challenges Felista have just spoken to. The 5 values are these. 1, funding should reflect a commitment to a broad-based coalition working beyond disease-specific silos and should focus on advocacy, not service delivery. Funding should be additive and not an extractive. And funding processes should be sustainable with priorities set by affected communities or those who are vulnerable. And funding should be built on trust and high levels of accountability, emphasizing joint learning, sharing information and strategies. And so going forward, and based on this conversation, and the reports can be made available to those who are interested to see the longer meeting of the report from the civil society. But going forward, what is important is for us to have joint discussions between donors, civil society, and multilateral institutions that will help us brainstorm through this challenge that we all agree exists, that civil society at national and regional levels are not getting sufficient funding for health advocacy, and there are gaps that need to be addressed. And so it's important for us to come together. As Maya said earlier, we have spoken to a number of donors who are already willing to come onto the table. And for any funder who's on this call and who's gonna watch this call, I would urge you to please get in touch with us through the Job Planning Institute, and we can have an exchange of ideas as we plan for this particular convening, because it is an important discussion that has been brought forth by the effects of COVID. We have seen that if you don't strengthen your national health system, if you don't have strong civil society to hold people accountable, then you can't make gains at the national level. And that's where most of the gain needs to be made. I'll stop there and turn it back to John to continue the moderation. Thank you.
Thanks, Alan. I also want to just acknowledge that David Barr is also with us today. He is working on this project at the Job Lang Institute, and he will be a resource for helping to answer questions. David, is there anything else that you'd like to add?
Hi, hello everybody. Just to say thank you to the speakers and to Felista for that great presentation. We're looking to hold the first set of joint conversations between donors and multilateral representatives and civil society leadership in the latter half of January. And we will be getting back to you with more specific information about how we're going to be doing that and how you can participate. And I'll stop there and let's open it to questions.
Thanks, David. You'll also notice on your screen that Sarah Hamilton is with us, my colleague at FCAA, who is fielding questions. Sarah, do we have any questions for the panelists?
We have one that we can start with, and then I just want to remind everybody, if you do have a question, you're welcome to add it to the chat or the Q&A function, or you can, I think there's a way for you to kind of raise your hand if you want to ask it live. But in the kind of, to begin with, maybe if we can go to a couple of questions. You know, we're talking about this and sort of the role of funding for health advocacy. I was wondering if any of the speakers could address sort of how can we do a better job of tracking funding for health advocacy, as well as like how could we do a better job at both evaluation and also promoting sort of funding for health advocacy. So the question there being, how do we talk about tracking it, evaluating it, and then promoting it, if anyone wants to kind of address those topics. And then I encourage everybody on the call to enter their questions, or you can also email me at sarah@fcaa.org, and I'll put that in the chat as well.
Hi, Sarah. Maybe I can get started and share some thoughts. I think, you know, just thinking about the work that activists had done, you know, around the 2016 high-level meeting and the political declaration, and how much we celebrated when we saw the commitment, 6% for social enablers and 30% for community-led responses. We were very excited. It was a big win. And finally, we felt like we had something tangible that we could hold governments accountable for, only to find, you know, down the road that it's not as easy as it seems. And I think the conversation that's happening internationally around defining community-led responses so that we can then quantify and cost what these interventions are like, and then be able to track it. I think, you know, we're almost at a point where we even have to start there. Yeah, I mean, I think it's also about this kind of shared definition. I think that's where that response for me was going. It's just about having a shared definition of what is it that we're tracking actually. What is it that health advocacy entails? So what are the interventions that we're going to be tracking? And then the issue around transparency and access to data, that in many instances it's quite difficult to get access to data, even from kind of which donors are funding what. And during our research, we also encountered that it's not as easy as we think to access information about who's funding what. So I think there's also an issue around transparency and access to information that we can consider and that we need to think about.
Great. And John, if you allow me, I'll just build up on one more point that Felista has raised. And part of us coming together through this consortium of civil society organizations and community-based organizations that want to put for national health funding for health advocacy at a national level, one of the steps we've taken through our mailing list is to ask people to share with us interventions that have worked, and we shall compile these interventions that would give examples around how health advocacy has worked, because a number of institutions have been doing this for a number of years, and we know what does litigation involve, what is working with parliamentarians involved. And that is one way we can pick up from a number of these reports that you're putting together that will be able to show this is the kind of work that funds, this is how it was funded, and this is how you can then be able to scale it up to other regions, to other countries, to other institutions, to other movements, to be able to have the right effect within health advocacy. I think in terms of tracking funding, beyond having percentages that are supposed to go to civil society, it is also important for the donors that give money, particularly multilateral, such as the Global Fund or Gavi, to be able to ensure has the money achieved what it's actually supposed to do. And not only in terms of service delivery, it is important to get the drugs to people, to get vaccines to people, but there are certain components of advocacy that should be measured. And previously, the Global Fund had supported a regional grant that was able to show that it is possible to do human rights work within the region. And this was a grant supported by UNDP, by ARASA, by Endasante, by Kerlin, and by the South African Litigation Center, whereby we were able to use multilateral money to be able to do advocacy that included litigation, that included working with parliamentarians, that included working with law enforcement officers. So it's indeed possible to track, it's possible to evaluate, and it's possible to scale up and see who can be reached and how can we be able to take this forward. Over.
Thanks. Maria, anything you'd like to add?
Yeah, no, I think what Felista is raising is a really important thing. How do you measure success in advocacy, and what do you consider to be a result? I think we have that discussion also in the Netherlands. Right, this very morning I have been reading a report on the impact of our partnership programs where we support advocacy at country level. And then our programs are in many cases a combination of service delivery and advocacy. And then for service delivery, you always have these nice tables with so many people who are reached with SRHR services or condoms or contraceptives or whatever. And if you talk about the impact of advocacy and you try to measure the number of laws that are enforced or whatever, it's really hard. And I think it is important that we get this common understanding on how we measure success, also to make it attractive for donors, to make sure that they can present some progress. And in many cases, even, keeping a status quo may be a signal of success. But how do you define impact of advocacy? And you talk about, the importance of, we talk about the importance of civil society to hold their governments accountable. But if we invest in civil society organizations, how can we hold them accountable again for their work? And it's not a nice discussion, it's not that we do not trust organizations, but I think, we have come to a point where we think that, you know, funding civil society just out of, you know, because we believe it's a good thing, it won't sell anymore. So I think that's an important thing that you are raising. And I don't know the answers exactly, but I think we do have some experiences that we should also harvest and see what we can learn from studies looking at impact for advocacy. And I think for us, it's an important message also to bring along also to David and Ellen and myself when we talk to donors. We perhaps should try and as I say, harvest a little bit more the evidence of, that makes it measurable.
Thanks. I know that FCAA has done some work in collecting and presenting information on how to measure advocacy, the effectiveness of advocacy. And so we can certainly mine our resources and include them when we send this recording out. Sarah, are there any additional questions?
John, could I add one more
Sure,
piece
yes,
to that?
please, yes.
You know, the challenges of evaluating the advocacy work, these are questions that we've been talking about for a very, very long time. I think through the joint discussions, we can certainly present a whole slew of ways in which advocacy work has been evaluated, and we'll do that. It makes me think back to when I was doing work with the HIV Collaborative Fund. This was, you know, the early 2000s, and we were doing small grants to local organizations, local and national organizations around the world. And I could do some quantification of what came out of those grants, but what was harder to quantify was that a whole generation of civil society leadership came out of a set of small grants that supported community mobilization and advocacy. So people that many of you on the phone now know because they are now members of the Global Fund Board, they're members of the UNAIDS PCB, they're members of their CCMs, they're involved in the PEPFAR COPS programs. They've really been leaders in HIV treatment and prevention and human rights work. But all of that came, so many of these people came from a small organization that was supported through a small grant in which the organization was able to set the parameters of what they wanted to do and how they wanted to do it. So we should talk about how do you quantify leadership development, and the thing that you fund 1 year, you may not see the results for 5 years or 6 years, but that doesn't mean the results aren't there. Over.
Thanks. Sarah, any additional questions in the queue?
Sorry about that. Thank you. I put my video on because I feel like I was nodding along vigorously with all of your comments. So I wanted to add my support there. And particularly the piece about even the definition has been a challenge. We did the last mile funding report at the end of 2018 that looked at we were trying to bring recommendations from funders for supporting community-based responses, and even coming to that definition of how we would define what that was to start that evaluation was a pretty big part of that conversation. So I agree with that. I want to add, just to emphasize, if people have questions, they could add them into the chat or the Q&A. I was curious, and I think this was part of the RASA report as well, but in October, AIDS Funds released a report about funding for key populations and noted, and it was about 2% of overall global HIV funding. And I was curious what the role of support for key populations is in this discussion. I know it's kind of noted in some of the RASA findings about the quote on teddy bears and when you're doing work with sex workers and et cetera. So I was wondering if anyone has comments on that connection. And then I think we have about one more question after that. So if anyone wants to take that one on.
Yeah, Sarah, maybe I can start again. I think that's one of the things that concern us at ARASA the most about the state of HIV funding in Southern and East Africa. The fact that all of the funding for key populations work, or almost all of the funding for key populations work, is externally funded. And with several of the countries in our region transitioning to upper middle income countries, it's been really, it's been a great concern in terms of who's going to continue funding the key populations interventions that are funded externally. And I think it also brings up this issue around the fact that even as we talk about national ownership of responses, we should know that there are some activities that are not going to be funded nationally. And advocacy and social enablers work, human rights programming, as Ellen was saying earlier, is going to be one of them. But also key populations work is not going to be funded by the vast majority of governments in our region. So I think we certainly as ARASA are looking at ways to step up some of the advocacy around those issues with donors, particularly funders who are funding in countries that are transitioning, and maybe looking at kind of World Bank classification to use that as an excuse for transitioning. It's that key population work is going to suffer the most, and human rights programming and advocacy, those types of activities are what's going to suffer because they won't get funded. And in some way, I mean, maybe we don't want governments to fund human rights programming. So yeah, that's my response to that.
Anyone else want to comment?
I think I would say what Felista said is entirely true, and our experience has been that in many of the countries we have engaged with in this process of advocating for national health funding, many of the key populations are criminalized, and many of them do not access to even registration that would allow them to be able to get funding. And so it's equally important for us to see how does a funding mechanism that is seeking to reach vulnerable groups have some level of flexibility that sees us getting to populations that would not ordinarily fit our usual institutional checklists and criterias, and find a modality that would allow us to be able to support them to do the advocacy. And I think this is something that has been done before by ARASA in the past. This is something that we've also done within a Global Fund grant, where small grants are given of up to about say $10,000 or less, or 20,000 are given to community-based groups to do specific advocacy efforts towards changing a particular issue that is currently pressing. And I think the challenge that we face, especially in the global south, many of our countries, even for key population programs, fully rely on donors. So our harm reduction programs, our MSM programs, our sex worker programs are all either Global Fund supported, are partly PEPFAR supported, or partly supported by a certain donor. And so again, we have to be aware that there's that gap where we are seeing less and less willingness of governments, especially in the global south, and even some in Eastern Europe, where countries are transitioning, wanting to put money for service provision for key populations. So this is an area that is important, and we may want to see how we prioritize that and try to ensure that key populations are also at the center of the health advocacy response. Over.
Thanks. I also, Sarah mentioned the last mile funding report, and Matt Greenall is one of the participants on the call, and I'm not sure that the chat is getting captured in the recording, so I just want to share one of his comments to make sure that it's part of the recording. He says, "Thanks for the great presentations. I think it is worth emphasizing that in terms of how money is provided, granted, there is evidence that funders can get this right. It is feasible for them to be good partners to CBOs, marginalized groups, etc. Educating funders on what their peers have done and achieved in terms of taking the sorts of actions and processes described in Felicitas recommendations would be a good step." Sarah, any other questions?
Yes, actually, we Matthew's raised his hand, so I'm going to try and make it so he can speak and ask a question live, if that's okay. One moment.
Great.
Okay, Matthew, I think you are able to talk. There you go.
It just said you unmuted me. Brilliant. Sorry, my camera's not on that, but my computer's switched off. Yes, thanks again, and thanks, John, for reading out that comment. I was going to, the reason I raised my hand was just to comment on, add something on advocacy funding, because it came out in Alan's comment just now, and also in Felicita's presentation, and of course also in the last mile funding work we did. There is this sense, I think, with advocacy funding, the assumption from funders is that advocacy has a goal and it has a beginning, a middle, and an end, and you identify a problem and you fix it. And I think, you know, something we need to make the case, not that we've not tried, but continue to make the case on with funders, is that funding advocacy isn't so much about funding results, it's about funding the capacity for organizations to be able to advocate and to react. Because, you know, a lot of these issues, I don't know, if we think about problems like stockouts or discrimination against certain categories of people from the health service, you know, they don't just get fixed and go away. You know, they come back 6 months later or 18 months later, because they, you know, they rear their ugly head and they're part of systemic stigma and discrimination. So it's that real emphasis in these proposals about saying, well, actually these groups, these community organizations, they need the capacity to observe what's happening, and that's where all the, you know, community observatory work and accountability work comes in, and to react to it. And they can document what they do with that money, but they can't necessarily predict where it's going to go. I mean, we don't want to predict what problems we're going to face. You know, it's that's a bit dismal. So, and then, you know, and just to underscore that, you know, there's a reason why the types of funders that are highlighted and that are the, you know, that are more popular in these types of studies, it's things like rapid reaction forces or rapid reaction funding and so on, because it's designed to react on that. But I'd rather, I mean, that's great, I'm glad they exist, but I'd rather local organizations just had the capacity to react without sort of saying, oh, the shit's hit the fan again, where do we, you know, who can we ask? So that's what I wanted to add. Thanks.
Thanks, Matt. Do we have any other, I'd like to give everybody a chance to make a final comment if we are through with the questions. Is there anything else that we need to address?
I think that's a great plan. Thank you.
Great. Okay. I'm just going to go in order of my screen. I'll start with Maria and just ask each person for final thoughts. We'll end with David, who can maybe remind folks of how they can engage with this project. Maria?
No, thanks for the conversation. And I don't have any specific comments at the moment. So please, I'll give my time to others. Thank you.
Thank you. Thanks for being with us today. Felicita?
Thanks, John, and thanks to the fellow panelists and everybody is here having this conversation. I know it's late in the year and everybody's tired, but I think this is such an important conversation, and somehow it always energizes me to, you know, to talk about something that I'm quite passionate about. And the way that we at ARASA see our report is really that it's a conversation starter. So we're very honored for the fact that you've invited us to have this conversation. And we're actually excited to see where the conversations that Maria and Ellen and others are having with donors will go. Because I think in all the years that I've worked at ARASA, which is about 11 years, the most effective advocacy work that I've seen has been when communities are at the forefront solving their own problems without anybody telling them, this is how you should do advocacy, this is what you should do you have a template, do you have this, do you have that? When they're able to just have the amounts of funding that Ellen was talking about, $5,000, $10,000 US, channeled in a way, as David was describing, the HIV Collaborative Fund used to channel. So having that kind of flexibility is where we've seen the most impactful advocacy work happen in this region. And so I really buy into the importance of this conversation and really look forward to continuing it with you all, hopefully in the new year when we're all a little bit more refreshed as well. Thank you so much for having me.
Thank you. Alan?
Thank you again to Maya, to Felicita, to Sarah and David and Matt, who have given incredible comments, and John, indeed, for the funders concerned against it for hosting us. I just want to emphasize the point that Felista has said, that indeed, if supporting national level advocacy to ensure that we are on track with things such as the UHC targets, if we want to improve quality healthcare services, if we want to increase domestic resource mobilization, and if we want to protect human rights within health systems, we need to start thinking through around how do we support national level health advocacy. And for us to do this, we need donors to come together, we need civil society to come together, we need multilateral organizations to come together for us to be able to have a conversation. And so for those who are interested, again, I say, let's come, let's have a conversation. Nothing is decided in stone, but what is important is that everyone agrees that it is important to fund health advocacy, both at the national and regional level, and be quite supportive of trying to get into the targets. Wishing all happy holidays and looking to further engagements with others on this. Thank you.
Thanks, Alan. Before I turn it over to David to wrap up for us, I just want to go back to where I began with mentioning our new strategic plan. And you know, the new strategic plan talks a lot about the value of HIV-informed grant making. And this conversation has used a lot of examples from HIV, but the effort it goes beyond HIV and is broader than HIV. It's about health advocacy broadly at the national level. And so I want to thank, again, our partners, Africa Grantmakers Affinity Group, Human Rights Funders Network, and the Global Philanthropy Project for helping us to reach beyond our typical circle and to also to take the lessons that we've learned from HIV and use them to advance health and rights for even more people. And with that, I'll turn it over to David Barr, who will wrap us up.
Hi. So also thanks to everyone for participating, and particularly to FCAA for setting all this up. We will be contacting everybody who's been on here about our follow-up, and again, hope to have the first set of joint conversations in the latter part of January. If anybody has any questions, if you'd like to have a follow-up conversation that's, you know, where you can ask more specific questions, just contact me and I'll set that up. So thanks to everybody. I hope you have a good holiday, safe, healthy holiday. Thanks.
Thanks, everyone.
Thank you.